Good day, everyone, and welcome back to another edition of the IDRiM podcast. Today, we're going to follow on with our conversation from last week on ethics, and today we're going to focus a lot more on COVID-19 as a case study. And now, COVID-19 ethics, we're going to look at what we did well and what we didn't do well. We hope you enjoy today's episode.
So, well, looking at the discussion of the international aids and how certain countries dependent on it. Well, I come from a country that looks like dependent on the international aid from Indonesia, from the
Sorry. When you say international aid, are you saying for disasters or are you saying for development? Because I'm not talking about
disaster.
Okay. Yeah.
Because I will give you an example from the Aceh tsunami 2004, where a lot of the nations come in, and then we have certain disaster, and somehow our government try to use this opportunity to get more aids to come in India, not only for recovery but also for development. Although that they relied a lot on this kind of disaster response aid sense. Now, looking at the bigger disaster that we have already recovered of all, which is COVID-19,
Yeah.
do you also observe the certain dynamics of looking for aids, looking for requesting an aid or not from several countries that affected by the COVID-19, or just how it develops during the COVID-19 pandemic?
So you're asking if developing countries have asked for aid as a result of COVID-19?
Yes, or within the during the pandemic itself.
So I haven't seen any of that, but my reading might be too thin. I might just have missed a lot of that. What I saw more frequently was countries being denied access and then having to ask for it. So we see a lot of the African countries not getting access to vaccines and having to, like, not beg for it, but just really, really hardcore ask for it. And then it still didn't come through. And it was a matter of prioritization of Europe because that's where the vaccines were being developed. There was a cost involved, how much they were going to cost and could the African countries afford it. So I don't think I have an answer for your proper question, but I have seen the opposite where it's asking and not getting. And that's for whatever reasons we want to call it, right? So it's not disaster colonialism in that way. It's absolutely just ignoring other societies. People will say it's because we need to prioritize our own people. And there is a call for that. So, you have a responsibility to your own citizenry first, and then you have responsibilities externally. So you have to make sure that, like, if your people are dead, then there's nobody that you're working on behalf of. And so you don't really have a job anymore. So you have to kind of make sure your people survive, and then you can make sure other people are surviving. And so I get that. But once your people are getting their third and fourth round of COVID vaccine, maybe it's time to think about access for people getting their first and second rounds, especially when they're vulnerable populations and have structural inequalities and have centuries of, structural issues that have been exacerbated by the wealthier countries. Like, did we cause the problems that mean that they are not as wealthy as European countries? Things like that.
Okay, so let's just get into the COVID then. What are the ethical failures of success do you believe that COVID-19 exposed most clearly, either, in the UK, where we're both based, or globally?
So the global, I'm going to go back to the answer that I gave to the previous question. And I think this undermining of countries' capacity to support its own citizenry with things like vaccine, I think that's a big ethical failure of the international community. And I'm not putting blame on any individual or any individual country or anything like that, but the fact that we did not equitably distribute vaccines during a global pandemic. It's not something that was, disproportionately affecting certain countries or others. We just, everybody was affected. So I think the vaccine distribution was an ethical failure. I think when we look at national governments, I think a lot of countries did not have a preparedness plan, or if they did, it didn't account for the scale of this pandemic. And what do we know about pandemics? Well, they happen about every 100 years. We knew we were due for one. Whether or not we wanted to believe it, it's one of those things. It's like saying, well, you'll probably get an earthquake because you live on a fault line, and going, nah, it didn't happen in the past 10 years, so I'm not going to worry about it. So I think there's this failure of preparedness, failure of foresight, but maybe it's also an ethical failure of, how do I put this? Like being so caught up in everything that's day to day, business crisis, like the day to day things that are happening, that we didn't put enough money aside. We didn't put enough belief into the fact that preparedness will save lives. And I think that maybe one of the ethical failures is that we didn't think about this ethically. We kept thinking about the possibility of a pandemic as like a practical thing. Very good. Please look at it. I don't think we put enough energy into preparing practically. And so I think that's an ethical failure in itself. But I think that we're not having enough conversations about the ethical implications of things. And if we do, we kind of break it down to its easiest way of understanding when you go, yeah, but like your mom's going to die. How what are you going to do about that? There's an ethical problem here, right? Like it's going to suck. So what are we doing on a grand scale so that everybody's mother or grandmother doesn't die? And I think that I'm not trying to make ethics emotive, but I think ethics bring out a bit of, well, who do we have a responsibility to? Why do we have a responsibility to them? Who's actually going to die? Okay, well, it's the workforce. Cool. What workforce? What are we actually talking about? Are we going to be able to continue to educate our kids? Are we going to continue to be able to like go to the grocery stores and continue to eat? So I think that there's this lack of integration of ethics into preparedness and planning that is actually our overriding ethical failure.
Is that then a case that our preparedness plans, and by the way, in the UK, we did a scenario run only a few years before this, didn't implement any of its findings, and we also had no plan for lockdown.
Yeah.
Lockdown just came out of the blue. But isn't this now becoming a question of that one of the issues from a preparedness point of view, but also from an ethical point of view, is that we're very top-down planning. But we plan for we look at the pure numbers, and we literally treat people as a number, not as a. And you say about about emotive ethic, about being people's emotional around ethics. But surely we should have that element implemented, that we think about people's emotions as well, because I think of the UK, and I literally was just sat down with a few professors who were talking about implementation gaps, for disasters. And one of the things I was talking about was these lockdowns, very much so. And I said, well, it's all well and good hitting number targets to, what as we called it, flatten the curve so that our health service wasn't overwhelmed. At what cost? And mentally, where you literally say goodbye to your loved one who is dying from COVID-19 on a tablet or over a phone, or not even say goodbye, then can't attend their funeral. What is that saying to us from an ethical but also moral point of view?
About the dignity of
dignity of death, but also not just for the dignity of death, but also from a perspective of thinking about people mentally, because we're not literally surviving it. We're only surviving. We're not living out what a natural life is.
Yeah, I think that's a great point. I think there's something, I don't know if you've heard of futures planning. So like you start from a future and then you work backwards kind of thing. And you go, okay, this is what our 2035 looks like. And then you go, okay, what caused us to get there? and then you can figure out what you have to change so that 2035, as I've presented, it doesn't exist. But what I like to do with my students is also like the absolute worst case scenarios, right? Like, let's think about all the things that could go terribly wrong and then plan. And I worry that we don't I worry that we look at, okay, this is how we're gonna fix things. We're just gonna fix things instead of looking at, what am I fixing? Like, what could really hit the fan at this point? I wrote a book chapter on like crisis management teaching and stuff, and using exercises, tabletop exercises, but making sure that not only was it the worst scenario possible, but also made sure that somebody in the scenario was a pain in the ass. And they made the worst comments and the worst suggestions and the hardest things that you could possibly overcome. Or maybe those were just my injects, like, right? Like, I just kept putting in like, oh God, why did this happen, right? And it's because if we don't imagine the worst happening, we can't plan for it. It's one of those things intellectually I don't think people have the capacity for. So I think that maybe one of the ethical failures in this regard isn't, I mean, yeah, sure, we didn't plan enough, we didn't implement enough, absolutely. But maybe we didn't give ourselves the space to imagine what the worst case scenario was. We didn't give ourselves space to really mess things up in an exercise, to just go, you know what if I did let 10,000 people die? What happens? And, you know, go through those gruesome details so that they play out. And then you find out, like you mentioned, Ashley, just going, okay, but now my mental health's all messed up. Okay, but now I'm not going to be able to go see my grandmother in hospital when she's dying. But now this is going to happen. Now this is going to happen. And I think that maybe we just don't give ourselves space to plan. So ethically, preparedness is the most important. So maybe we don't give ourselves space to think about worst case scenarios. We're so focused on solving problems that we don't actually explore the problem as it might be. And I wonder if that's just a structural governmental problem with, you know, we have to have results. When you do any type of tabletop exercise, it's like, okay, what did we learn? How are we going to fix it? And you go, maybe we need some scenarios where, oh, it all hit the fan, like everything fell apart. All right, now let's figure out what the problems actually are going to be if everything falls apart. Because I don't think anybody foresaw not going to see loved ones, not being able to have funerals, not like, I don't think anyone foresaw that. And if they did, they were probably like quieted. And so I think we need to explore the uncomfortable. Yet another reason that, as we talked about at the beginning, I don't want to become numb to death, but maybe we do need this kind of ethical, what are they called? You know, like the trolley problem, we need those thought experiments that bring out the absolute worst so that we can unpack the ethics of it and then go, okay, politicians and policymakers and implementers, we figured out all the horrendous possible ethical things that could happen. Go. Put plans together to solve all of those, and then we'll be good.
Well, the question is there any politician who wants to do that?
I mean, I would actually love to sit with governments and just be a pain in the ass and just go, but what if they all died? But what if there was a flood where you were going to bury everybody? Now what are you doing? And just like, you know, just going through those ethics like that. Go ahead, Ashley. Sorry.
Yeah, I was just going to say as well that actually in the UK, we're both based in the UK, so I don't know if you've seen this with Sky News right now. They're doing this very scenario run with if Russia invaded the UK and attacked the UK. So we do it in some circumstances in the UK, but for war only. Yeah. That's all we do it for.
Is that for ratings, or is that actually going to help people? So if you're going, okay, so if this does happen, public, this is what you need to have. Make sure you have this, make sure. If it's not for planning purposes, then is it just for ratings, or is it about, you know, making people scaremongering? You know, like, what's it for? And that would be unethical.
Yeah, and so my understanding is partly for ratings, but what they've said is it's based upon scenarios that they've already done, because these are actual former cabinet ministers, and so these are the scenarios that they run through, and they run it every few months. these scenario runs for war against the UK. So it's like, why can you plan for that one, but not plan for a pandemic, which is just as likely?
What I want to know is, do you have an ethicist in the room? Probably not. And I think that any of us who are ethicists of any sort really should fight for a seat at the table for every discussion, right? So when we have hospitals, there's always an ethics committee. Universities have ethics committees. Police have ethics committees and things like that. And the government has ethics committees, but not for day-to-day, COBRA meetings. Not that they're day-to-day, but these, when we're having a crisis or disaster, do you have an ethicist going, so you're cool with 10,000 people dying? I'm not judging, but if you are, what this says is that you argue or you are defending this as well. You are defending this kind of ethic. Is that what you intend? No, then you have to rethink. And it's almost, there's part of me that thinks it's a little bit silly for governments not to bring an ethicist in for PR purposes. To go, actually, we did think about that. And we made the decision that we couldn't save all of these people. And we recognize that this is unethical for this reason and this reason. But ours is based on this ethic. And so we went along with this for this reason. And wouldn't it make people feel, I mean, people are still going to be pissed off if their family members died, and rightfully so, and I respect that. But isn't there something in that says, but if we really thought about it and there was a decision that we could stand by, anybody who's doing situation response has to keep track of why they made every decision. And if they get called up to any kind of inquiry, they have to be able to go through and go, the information I had at the time said this, so I made this decision. The information I had at the time said this, and what I was understanding from previous training was this, so I made this decision. And we all go, fair enough. I get what happened there. And wouldn't that be great if governments the world over did that and had an ethicist on staff? I don't know. Pitching for a job. That's what I'm trying to do.
But I mean, that's what I in my mind right now. Like, is it the most important thing is like you having the ethicists as the risk communicators, because like that's what actually people wants to know, because like it's in the times of uncertainty during disaster and crisis, people want to seek information that within the ethical boundary that they can do, right? And no, but the communications, I guess like there are many, I guess, failures also how the government inform the people during the COVID-19, whether like as you mentioned, like in the settings that, what can I do, I cannot do this anymore. People like sometimes like make have make decisions that perhaps unreasonable or for other people, that they try to thinking about themselves instead of looking at the greater goods. Like, okay, if I do this, maybe we also harms the other people. So, do you have any thinking about that? How it's actually implemented in the communications between the government to handle COVID pandemics to the people who suffer from it?
I'm not a communications expert, so no, I don't have any way of doing it. But I think that the first step has to be recognizing that's what it is, right? So I'm sure that somebody is going, so if I make this decision, this is going to happen. And like, they're going through their own ethics in their own heads and stuff. But I think there should be a more structured understanding of what is our goal in this. Is our goal to save the most lives, or is our goal to recognize the dignity of all the humans, or is our goal to let professionals make their own decisions as the disaster goes? And like, again, I don't care which one they choose, but I think it's when we saw during COVID, hypocrisy is one of the worst things that any kind of government can do, ethically speaking, right? Because you're just going, wait, so you can break lockdown, but I can't break lockdown. I go to jail, nothing happens to you. And I think that consistent ethics is something that all governments are lacking, because I don't think that they've thought about it. I think that they're thinking about, okay, we want to save the most people, sure. Excuse me. I think they're thinking about, this is what we want to achieve, but I don't know if they understand ethically why that's the case, and how making this decision in this situation and this decision in this situation are actually hypocritical, because they don't understand the ethics underpinning it. Once it happens, society goes, hypocrite, there's an ethical problem there. But I don't think that in the moment, and I get why, right? You know, like that fog of war kind of thing. But I don't think that they have enough ethical know-how, hence the reason having an ethicist in those meetings might be good. When I used to work for the US government, I'd have meetings with, you know, like different agencies and then different countries. I always brought my lawyers, because I don't know the law and how it works, right? So so for me, it was like, well, if I bring my lawyer, they're going to make sure that I don't say something that is illegal. They're going to make sure that they've explained to me what I am negotiating, why I'm like, what the law says I'm allowed to negotiate, and then I can, you know, do what I need to do within the confines of the law. But I think that that's a really practical thing to do. And I think a lot of governments and a lot of organizations already do that. You always bring your lawyers with you. But I don't think that people bring their ethicists. And until we understand that law and ethics are not the same, and that ethics actually drives so much more of our disaster response than we care to believe, I think that's what we need to do. And then we can talk about a communications plan and how that all works.
Yeah, I'm gonna now hit the hypocrisy, and I'm gonna go into some very controversial bits here. So,
Okay.
So first of all, the hypocrisy in the UK, you know, of lockdown brought down a whole government basically in a roundabout way. Boris Johnson's government, they had lockdowns. You know, literally the worst one in terms of a PR point of view was literally having a party in lockdown the night before the Queen's husband was laid to rest. And that really hit hard to the British public. But also, I want to get from an ethical point of view some of the thought processes of some of the things that were being said. And we know this now from the inquiry. Let the virus rip. COVID is a natural way of dealing with old people. And these are the thought processes of what was said in the room. From an ethical point of view, what does that make you think of a government?
Let the virus rip. I'd like more context. Because if you're adequately prepared, letting the virus rip is not a problem. You're like, go ahead, do your worst. I'm good to go. Go ahead. Did you have more context?
Yes, I do. So literally, it says, let the virus rip. The elderly had a good innings. So therefore, why should we lock down the whole country?
It's with that. Okay. So, yeah, I mean, if we change that to any other kind of event, not even a disaster, and we said, well, this type of cancer only affects people over 65, screw them. I think that the conversation would be different. And so it's unethical, because our ethics in peacetime and our ethics in a disaster are different, and that's not okay, right? So who we think has value is not, must always be consistent in both peacetime and disasters. The other thing that just came to me that's like, I think is just interesting, is I'd be curious to know the cultural makeup of the people that were saying that. I don't actually want you to tell me, right? But like, there's this interesting cultural thing where certain cultures value their elderly more than the children, right? And there's justifications for it, like the wisdom, the capacity, like all of those kind of things. And so it's really like, it's also an ethical statement about a portion. It may be a very large portion, but it's an ethical statement about a portion of a non-homogeneous population. And so I'm not ignoring the whole, you know, deal with old people issue. I'll come back to that. But I think that there's this really interesting extra issue that ethically we do have to account for the needs and expectations of dignity from all cultures within a society. And it's like saying, so again, like if we go to Hurricane Katrina or something like that, or 9/11, those are the ones that like are easiest for me to talk about. How we deal with the dead. If there's a flood and we can't bury people, I mean, New Orleans, you don't bury people anyway in New Orleans, but if we can't bury people and that's what your culture says you have to do, well, how do we still treat your deceased with dignity? And so that's why I find the comment interesting, because it's a statement regarding a non-homogeneous culture that might not just take offense for reasons that I will get into in a minute, but might not just take offense, but also runs counter to everything that they ethically, morally, culturally hold dear. And so I think that's a really interesting ethical dynamic as well. As far as like, it's a way of dealing with old people. I mean, that's obviously ethically problematic, right? Because all humans matter equally. And so, we have obligations to all humans, no matter their age, no matter their ability to contribute to society. Otherwise, we should say that anybody, that's disabled, well, how much are they contributing to society? So we should let them die too. And it doesn't work like that, right? We believe and we defend that all humans have inherent moral worth, and it's not about what they can contribute to society. And so that's why that's ethically problematic. But there is something interesting. I don't know if you've come across quality of life years. QALY is how it's abbreviated, and I'm not good on it, so I might be like completely messing up how I explain this, but it's used in healthcare to determine the number of years, quality life years that an individual has left, so that you can determine whether or not they should receive certain medical procedures. So if you and I both needed a heart transplant, and I had, with the heart transplant, I would have 40 years of quality life and you would have 2, well, I have more quality of life years, and therefore it makes more sense. And it's not based on gender or my social situation. It's based on like, I don't know what it's based on, but it's based on these other things. And I wonder if there was a conversation, again, don't know, I'm trying to give everybody the benefit of the doubt. I wonder if there is a conversation about, well, it's not just about the number of lives saved, which would be a very utilitarian argument, but rather about the quality of life that people will have and the number of years that they'll have left to live. And so if we let it kill young children, then we're actually knocking out society's ability to continue in the future. If we let it knock out people of, working years, then the elderly won't have a pension and children won't have parents and teachers and things like that. So maybe it makes the most sense to, allow, if it's going to kill people and it's going to kill that group, maybe there's an ethical justification for it. The way it was said, I don't think that's the case. I don't think that kind of ethical, thought experiment went through, just from what you're saying, right? So not seeing anything else, just from the quote. We shouldn't be dealing with old people. We shouldn't deal with any group. We should always have, if not the mindset, at least the language that all people are deserving of dignity, and we have a responsibility to give them dignity and continued life. It is a right beyond a human right, like legally, it is an inherent ethical right that they have rights to continued life, and no one gets to decide that that's taken away from them. Like that's the important thing. You don't get to cut my life short because it's your choice, kind of thing. So I don't think I could ever justify that statement, but if there was an ethicist in the room, like going, all right, let's go through this thought experiment, what population is it affecting? We could at least have more of a conversation. But I get it that, yeah, we can't. That's just not an okay statement.
For that statement, what if, I don't know, will it make it ethical or not? What if the statement is actually coming from that group? Because like in Japan, after the 2011 East Japan earthquake, many old people wants to come to Fukushima and like want to do restoration
Yeah.
because of
Yeah.
the radiations, and like, okay, let me do it because like I don't
Yeah.
have more life
Yeah.
to spend, and your children to continue living. What do you think on that?
And how beautiful, right? Like there's something really beautiful about that. And thank you for understanding the way that I was trying to make my argument about COVID. Thank you very much for understanding that. It's their choice. And that's the difference, right? So every human has to be treated with dignity because because we're inherently morally worthy, and with that we have to be treated with dignity, respect, and part of that is respecting our individual choices for ourselves. Now, if that elderly group in Japan wanted to go and do that, and the government was allowing certain people to do that, anybody, then yeah, go for it. I think that's absolutely wonderful. First off, it supports their autonomy to make decisions. Second off, it is their contribution to society in this beautiful way that they're recognizing, their place in humanity and recognizing what they owe to other people that might have less or wouldn't get to experience as much as they have. I think it's absolutely beautiful. But the difference is that if the government is making those statements without conferring with the public, without getting people volunteering, to die, then it's not autonomous and you don't get to make that decision for me. Yeah, thank you. It's a perfect counterexample as to what I'm trying to say. Thank you.
Now, you've written about moral importance of protecting human dignity. Do you think that there was an adequate upheld of this during the pandemic, especially in how we treat the most vulnerable? So we kind of crossed into this, but
so I think it varies. Dignity, most vulnerable. I think it varies country to country. I think it varied community to community. I think it varied because of capacity. I think it varied based on political decisions, even like community group decisions. Like were certain communities vibrant enough to support their most vulnerable, even when government decisions might have undermined vulnerable populations' capacity to continue to live or like live dignified or good lives. If you take a place like New Zealand, where the excuse me, the number of deaths was much lower and they had very, very strict rules, we can look at that country and go, okay, so they made a lot of ethical decisions. They decided what was important to them. They said there's no wiggle room on this. This is how we're going to do it. And they enforced it and tried to enforce it with kindness, right? Now that's cool. And I'm fully on board with how New Zealand handles lockdowns and stuff like that. But if that played out in other countries, and I'm thinking Western European countries, England, or the US even, there's a very big, that's paternalistic, and you don't get to do that to me because that's restricting my autonomy. And I think a lot of countries and like societal dynamics prioritize individual autonomy over community welfare. I think in a disaster that works against populations. In many ways, I think there's good things that come out of it because it's that individual enterprising attitude of like, well, I'll go help, I'll go do these things. And you don't necessarily get that if people don't have as much individualized ideas. So I think that there's pros and cons to that. But I think that paternalism could also be problematic. And even if it was tried in the UK, in the US, or countries like that, I don't know if it would have worked. I think there would have possibly been rebellion to it. And that would not have helped a virus outbreak, having people protest, having people try to like overthrow governments in the middle of trying to handle a pandemic. And so I think that how we handle dignity of the most vulnerable has to account for the local, has to account for the community, has to account for the needs of the group that you're actually governing. And the other thing to think about, and why I think it can even be smaller than at a national level, if you live in an area where your religious groups or like women's institutes are really big and working really, really hard for a community, a lockdown probably like is not going to affect you as much, because you're going to have these community groups that are going to figure out ways of supporting the most vulnerable. And that's really, really important, right? So having these local NGOs, having religious groups, having society groups that bolster whatever the government is required to do, needing to do ethically, and then you have this backup. But in societies or in communities where that's not prevalent, then there's a big gap. And so this goes back to, well, does that suggest then that the government has failed because they need to have local society groups and religious groups there to fill the gap? Should it be the government's responsibility to make sure that the mental health of the people, that food deliveries are happening, all of that kind of stuff? Or should it be that, no, we should integrate these NGOs into national government policies and prevention measures so that they do the work that the national government isn't able to do? So there's that too, right? So figuring out how to support vulnerable groups in a dignified way in a disaster is not as easy as saying, this is what the government's going to do. It's who's the government working with? Why is the government working with that? Do they have does the government have capacity? If the government doesn't have capacity, that's a structural problem we got to deal with. But in the meantime, have we figured out a way to fill the gap? And I think that even working with local communities is crucial, especially in an era of austerity and in an era of, populations are bigger than the governments that serve them. I think the lack of engagement is the problem. Now, I know that local resilience forums and things like that within the UK at least do work with NGOs, do work with societal groups to make sure that those groups are prepared to support the most vulnerable, to support those that might be in some way undermined by a government policy in a disaster. They are already working with these groups, and that's absolutely wonderful. Are we integrating those into national level plans? Is it consistent if you live in London versus you live in the North? Or is there a difference in the quality and capacity of these local groups? And so maybe the national government has to look at that as well, understanding the vulnerabilities that exist. I think I went off on a tangent, but I hope that answers it.
I mean, I've got a question for both of you then. What is more important, individual autonomy or community welfare?
I don't have to have an answer. I don't have to have an answer because I don't think an answer is helpful. I think they're both crucial.
Yeah.
And then if community welfare is the one that you choose, okay, how much autonomy can we give people within that community welfare? Okay, autonomy is most important. All right. But maybe the line, that it goes, my rights stop where yours begin, so I'm not allowed to infringe on your rights. So maybe my individual rights, I still have autonomy, but my circle of liberty or my circle of freedom to make choices for myself kind of reduces a bit because other people's gets bigger. And so maybe it's just the circumstances affect autonomy in that way. I'm making this up as I'm talking to you. I don't know. But I definitely don't have an answer, and I'm not really interested in an answer.
Okay.
Well, yeah, that's also become a problem here in Sweden, where municipality has so much autonomy, where having a preparedness plan for the floods come from the climate change. It's very very difficult because they need to come to municipality to understand the risk, and they want to implement a preparedness plan, the nationwide preparedness plan. It's kind of which kind of a policy that can be implemented, not break down the municipality autonomy, because the municipality autonomy here is very strong.
Yeah.
But the nationwide, let's say, goals for resilience, and then in this case, go back to COVID-19, right? That's where we saw that some parts of the pandemics and the lockdowns, demand that resilience demanded of population who were deeply vulnerable, and how ethical it is that can when resilience become burden instead of virtue.
Interesting. When does resilience become a burden instead of virtue? So there's certain problems with the term resilience. So I think that if we talk about resilient structures, if we talk about resilient governments, we talk about resilient policies like laws that can work with things, I think that's okay. But I worry about thinking about humans as resilient. The idea is that if you're resilient, then you've gone through something, so you almost like have the antibodies, and so you understand how to fight the next time. Now, shouldn't the goal be that we don't have to fight the first time? So shouldn't we be preparing in such a way, maybe making resilient societies, resilient governments and policies and groups and stuff like that? Maybe that's our excuse me. Maybe that's our ethical goal. Maybe that's what we should be shooting for, not necessarily resilient individuals. Maybe highly prepared individuals, educated about disasters, practiced on disasters individuals. Maybe that will tick the whatever resilience box people want. But I worry that making resilient humans actually would require that we go through it in the first place. And so maybe we want to, instead of aiming at resilient humans, we want to aim at prepared and practiced humans.
I was just thinking, one of the questions I didn't put on there, but I've been thinking about it because it touches what I research, is a lot about when societies don't play by the rule book in terms of nihilism and vaccine skepticism and the ethics related to that. And I think that really built up our COVID in particular. Where's the ethical point? Where do we put the ethics there when people reject vaccines?
When they reject what?
Vaccines.
Oh, that's okay. Okay.
That's the last bit I was thinking.
Yeah. So if you reject a vaccine, that should be your choice. You should have the choice, your autonomy to reject a vaccine. Absolutely. But you don't get the choice on then where you get to go. So my rights end where yours begin. And if you're not willing to vaccinate yourself, then you have no right, no authority, no mechanism of infiltrating what I like to think of like from being a Girl Scout as my bubble of safety, right? So if you're not vaccinated, then you are accepting that you have to stay away from the rest of the population. Self-quarantine kind of thing. And if you're not vaccinating, we have to keep remembering as well that a lot of times we are not vaccinating for ourselves. We are vaccinating for the people who have compromised immune systems who can't get the vaccine themselves. So if the three of us were in a room and I had a compromised immune system, it's kind of your responsibility to get the vaccine so that you don't pass it on to me if we're going to be interacting. And it shouldn't be, look, I'm going to shelter more because I know I have a compromised immune system, and even if people are vaccinated doesn't mean I'm not going to get it. So I have to be extra careful for myself. So I'm going to self-isolate, and that's okay. That's my choice as well. But I think that there's an element of, but the people who have chosen to not get vaccinated, they don't get to be prioritized. So they don't get to have their way in the world just because they've chosen it. And I think this goes to a lot of like the vulnerability conversations of, I didn't make myself vulnerable. You're making me vulnerable. I didn't do anything to undermine my capacity to heal from a virus. You're doing that. And so because you are exacerbating my capacity to heal or recover from any kind of virus, well, you don't get to do that to me. And so you have to be removed from society. And I think it should have been a choice. Like, you either vaccinate, if you don't want to, that's absolutely fine, but you have to work from home and you're not allowed to the grocery store and you're not allowed this. And not because we want to stop you, but because you're going to hurt other people. You are a danger to others. We put people in prison who are a danger to others, right? Or we put people in certain restricted hospitals and stuff if they are a danger to others. Well, I don't know why we wouldn't do that during a pandemic. And not because, again, we're not putting them on house arrest or anything like that, but it's a matter of, oh, but your bubble of safety has gotten smaller as a result.
I'm actually thinking outside the pandemic, MMR. So I'm writing a paper on this right now.
Yep.
And with, people who are refusing MMR, we're seeing outbreaks of measles in Texas, now Los Angeles, San Francisco, Los Angeles, I can't remember which one. But because people are refusing to take the vaccine. Problem with this is that in some of these cases, children can't have the vaccine until a certain age, because of their immune system. But also, there's this case of breakthrough cases where they come into contact and their immune system just can't cope with it. And where do we stand ethically there then? Because somebody refusing to take a vaccine is doing harm outside of a pandemic time.
I'm not going to get into that because it's outside of a disaster or crisis. I think within a pandemic situation, it is a clear line for me. Outside of that, I think it's more complicated. Circumstances alter cases. There you go.
Absolutely. Okay. What emerging challenges do you see on the ethical horizons of disaster management?
I see it as, and it's something that we talked about right at the beginning, climate change impacting disasters. It's not just that a disaster happens. It's like, well, climate change happened and therefore disasters are worse and things like that. I think it's multi-disasters. I think it's compounding of issues within disasters because we're chasing our tails a little bit with the increased number and impact of disasters, and climate change is obviously, like out of control and stuff like that. I think that it's the multi-disaster issue that we're going to have a lot at the same time, and we don't necessarily have capacity to handle them all at the same time, both at an institutional level, but also as an individual. I mean, we have a heat wave right now in the UK. And if on top of that, we had some other disaster, well, we're already a bit compromised because everybody is a bit brain foggy from the heat and stuff like that. So I think that the multi-disasters, the compounding of issues is slightly separate, but it's when we see that vulnerability is being created by society. So let's say because of gender, because of race, because of sexual orientation, because of levels of poverty, those issues aren't going away. And you'd think that in 2025, those issues would at least be, like reducing. And those issues really, really aren't going away. And in a lot of conversations, they're getting bigger. And so when you have those issues around trans rights, around religion and stuff like that, when you have those issues becoming bigger and bigger problems as far as society sees them, or the conversations are problematic, then when you have a disaster, it compounds the vulnerability because those people were already having increased vulnerability because of structural dynamics around them. And so if you add a hazard on top, it increases the impact of disasters, going back to my original, risk or disaster equals hazard plus vulnerability. And so compounding of issues and many overlapping disasters.
Well, we're talking about the future consideration here, and like I came from the conference about the risk, and like they also mentioned a lot of ethical framework of AI. So so do you think that now people using AI, even though just respond and preparedness, will also bring its own ethical issues, or it's just another layer of ethical framework that needs to be prepared in terms of disaster preparedness in the future?
So I think that there are ethical issues with AI, just full stop. And I don't think that we are properly discussing them in society. I don't think there's the capacity to properly understand them because enough people aren't trained in AI or trained in ethics. So that's its own issue. But as it relates to disasters, I think it's just another compounding issue. And I think just like any other kind of vulnerability, all these things that are popping up in our society that we haven't sorted, what I think is interesting for AI giving us another dimension is that we don't quite know what other problems it might cause. And so unless we do worst case scenario kind of planning, we're not going to unpack what problems AI is actually going to cause for disaster response. I mean, a lot of people think that, oh, well, we can just get AI to do these things. And I'm not confident that, especially in a disaster situation, that we can rely on AI, which we know to have been biased in the past and stuff. I don't know if we can rely on it to actually help us make the ethical decisions that we need to.
Yeah, and to add to that AI has a tendency as well to mirage stuff as well, which can make situations a lot worse.
Yeah. So so those are problems we know about. Can you imagine what we don't know about yet or haven't put two and two together? So like I like creating the most ridiculous scenarios. Hey, you never know. And in those like remote situations where this is going to happen, I mean, completely far-fetched and completely whimsical and ridiculous. But what if in 5 years AI rises up against us and shuts down the whole like telephone system? Okay, well, have we thought about what that means for disaster response? Right? So like we have to almost think in the most ludicrous ways to understand what's possible with AI. And I don't, just like with other planning that I talked about before, I just don't think that we're talking enough about the most ridiculous possibilities, the most harrowing possibilities, and we're not pulling back from that, like the ethical implications.
And finally, if you had the ear of world leaders, what ethical principles would you urge them to embed into future disaster policy?
Yeah, so I don't know if I would stick it to an ethical principles. I think more so, I just want them to embed ethics. So no matter what ethics you adhere to, you're going to think about vulnerability. No matter what ethics you adhere to, the human matters. And so I'm not stuck on or going to like pin my hat or whatever the phrase is to certain ethical principles. I think the fact that we don't openly talk about ethics in disaster response is the problem. And I'm not here to shame any governments. I'm not here to say that any governments are doing it wrong. But the fact that it is not a constant component, and not just constant component like, oh, well, we talked about it ethically, but did you actually do it in a structured way? Did you have an expert in that could guide the conversation in a way that would come to certain outcomes? Ethics shouldn't be a tick box, like how are we actually integrating? And I think that's my overriding message, making sure that we have structured ethics and ethicists involved in the conversations so that ethics isn't a tick box, it's an intricate part of how we do disaster response and, more importantly, disaster preparedness.
Any further questions, Harris?
No, that was great, by the way. It's very long. I can tell discussion on ethics and disaster.
And it can just keep going, right? Like you know that any circumstance, and that's why this whole like circumstances alter cases, you're like, well, in that circumstance, I think that there's different issues at play, and it's really, really involved. And there's so few people globally that work on disaster ethics. Like I think I have the list, right? So it's an incredible thing that we're not talking about it more often. And that's why I thank you very much for this kind of podcast, because it really gives me a platform to say, just think about it, please. Like just bring us ethicists in, please talk to us and let us argue with you, not because we're going to tell you you're wrong, but because we really need you to unpack these ethical dilemmas so that you're not hypocritical, so that you save more lives, so that you have good PR, whatever you need it to be. but please bring us into those conversations.
And thank you for coming along. It's been a great conversation. And we hope to see everyone on the next episode of the podcast.
Thanks.